It's time for another podcast by George. Straight talk, straight from the Heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? Welcome to another podcast by George. Coronavirus 2020 still under deep quarantine at my house. I hope everybody else is self-quarantining. We need to get off the streets, get in the homes, and ride this thing out. And, you know, I tell everybody, don't get your information, particularly medical information, from a podcaster. Don't get it from a news anchor. Don't get it from a politician. Get it from the medical professionals. Get it from people that are out there on the front lines. And that's what we're doing today. We've got Dr. Jason Kruse with the Broadlawns Medical Center here in the Heartland in Des Moines, Iowa, coming on the podcast by George Live Line to describe what's happening at his facility. Good morning, Dr. Kruse.
Good morning.
So maybe the open-ended question is the best way to start this. It's another day. It's unprecedented. Nobody's seen what we're encountering here in this part of the country. It's obviously going to get worse. This is not the peak of this. This is the tip of the iceberg, so to speak. What's today like?
Well, right now we're mostly waiting for a surge to hit. A week or two ago, New York was still in this holding phase. They had a couple of hot spots, but they weren't sure how bad it was going to get. Now they're running day to day. So right now we're going through all our preparations, trying to make sure we've got all of our staffing plans. We've got contingency planning going on all the way up through, 150% to 200% capacity. Within our institution, across the city, and really across the whole state.
When I was in broadcasting, I remember describing to folks that Des Moines as a market, as a broadcasting market, was like 30th in the country. Kind of gives you an idea of where we sat as far as broadcasting is concerned. In the medical community, you guys are surprisingly large. Broadlawns Medical Center's got over 100 physicians. You've got over 200 beds. Is that correct?
We're approved for over 200 beds. We've got, I think on our main medical floor, we've got 49, we've got 6 ICU beds, and then we've got overflow capacity. So there's a difference between what you're approved for from regulators and what you're actually running.
I see. Well, we had just here this past week, Katie Ostad on. Now, she's a nurse she's in a major medical facility. She's dealing with this in the southeast, actually, where they're being hit harder, quicker, in Atlanta. And she was describing for us how they've made changes. They've moved things around. For instance, they closed down their heart section of their hospital basically to accommodate the COVID-19 patients. Are you doing some shuffling like that with your departments and areas as well?
Yeah, absolutely. We took an early lead to make sure that we slowed down and then shut down elective surgeries to preserve space and personnel, also to preserve personal protective equipment, which is a really hot topic around the country and around the world right now. We've shifted so our walk-in clinic urgent care on campus is predominantly seeing people who are symptomatic for things that might be related to COVID, fever and cough. People who aren't having infectious type symptoms are being directed to the other end of campus and being seen by our primary care team to help them address their acute concerns. We want to make sure that we're protecting people, but also addressing their routine needs.
And what about the testing? Are you testing now? Can people contact you if they're symptomatic and get tested?
Yeah, so testing has been very limited. It's one of those where the numbers have just not been there. We've got enough swabs and we've got enough viral media now, but my understanding is the overall throughput ability statewide and regionally is just not where we'd want it to be. So we're running some tests. IDPH put out their most recent recommendations about a week ago as far as who should get tested or who should get priority for testing. Certainly people who end up in the hospital who have respiratory failure, aren't breathing well, and we don't have a good other reason for it, are getting tested. People over the age of 60, especially if they have comorbidities, heart disease, lung disease, etc., are being tested. Healthcare workers can get tested due to the limited number of tests available. If you've got mild symptoms, we're telling you to stay home. We're sending you home for a prolonged period to make sure you self-quarantine, but we're not necessarily testing everybody because there's not enough material.
And you can only go with what you've got What's your feeling or what's your take on those tests? Are they accurate, or are more people carrying this virus than we think because those tests just aren't up to the task?
Yeah, I think between the limited amount of testing we've done, we've done a fraction of a percent of the population in Polk County and across the state. It's been a really limited as far as population surveillance. And there are increasing questions about whether or not the test produces a lot of false negatives. That's patients who are actually infected and the test doesn't detect the virus. There were concerns early on that might be related to swab technique. I don't know that that's the case. I've seen reports in the media. I haven't seen anything specific from the state, but in the media talking about 20 to 30% false negative rates. The upside is the guidance is stay home. If you are feeling unwell, certainly staying home, even if you're feeling well, to stay well is important. But if you're not feeling well, don't kid yourself. Don't be the one going to the grocery store. Don't be the one going into work and toughing it out. If you're isolating anyways, that's helpful. There's not a specific treatment for coronavirus at this time. And so if you get a diagnosis and it confirms it, it helps you confirm your concern and hopefully prompt you to be tight with your quarantine. But it doesn't change what we would give you for medication or treatment. If you're not developing severe symptoms or problems with your heart or lungs, we're going to tell you to deal with those symptoms at home. And about 80% of people will have mild to moderate symptoms not requiring medical care.
When we were talking to Katie Ostad, again, she's in Atlanta in one of these really busy hospitals, and they're already feeling this shortage. She talked about how the only approved mask for this for medical professionals, they get one. I mean, and they put it in a paper bag and they try to use it and reuse it. The gowns are in short supply. All of the PPE, as it's called, is running out for those folks. Are you well stocked? Do you have enough to take us through this, or are you going to be looking for new supplies here?
I think we're looking for supplies just like everyone else is. I think we're okay. We're not on a day-to-day status. Realistically, these masks are designed for a one-time use. That's what they're intended for, and so it labels on the box. Guidance coming out from IDPH and CDC has said that you can use extended use or you can reuse with caution. Right now at Broadbonds, we're doing something similar to what they're doing at University of Nebraska Medical Center, and we're using UV lights to help sterilize the masks between uses and limit the risk that you're going to put it back on and contaminate yourself. This is certainly not how the masks are designed to be used. That said, we would rather have suboptimal use and enough to get us through the coming weeks and months rather than running out in the next couple of days.
Suboptimal. I mean, does that work, or just kind of ultraviolet light? I mean, is that going to work? Or probably nobody knows because of the virus itself.
Yeah, I think that things are new enough that there's not any large scale studies. No one's going to be able to compare how a facility using UV versus a facility not using UV compared as far as infection rates of staff. And I think that's obviously concerning. But I think the reality is we'd rather reuse these masks that are medical grade than have to divert to using cloth masks or bandanas. We appreciate the cloth masks that everyone has made, but those are truly supposed to be used as a last resort if nothing else is available.
Interesting. Well, okay, so let's say I'm watching Podcast by George right now. I'm at risk. I've got respiratory issues. I'm fearful that I might need a ventilator. Where are you at as far as ventilators are concerned?
So certainly in town, we've got enough ventilators for now. The rate of rise in cases is what's going to determine how fast we run out. I think it's important for people to understand the concern with this is partially the total mortality rate, but the bigger concern is that if you have too many people get sick at the same time, you will not have enough doctors, enough nurses, enough ventilators to take care of everyone who's sick in that moment. And so then the risk is that people you would otherwise be able to save from their COVID or from their other routine health problems that we would be expecting, if there's not enough materials, it doesn't go well. I know that Polk County has all of the hospitals are working together to pool resources. There's oversight within the county and then across the state level where they're trying to coordinate to know what resources are available day to day. Right now, we're okay. It's very difficult to know where we'll be in the next couple of weeks, depending on how our mitigation strategies have gone.
And again, on the coast back east, they're going to field hospitals. I mean, once they get to where they're overflowing, they've got to find other facilities. Do you have contingency plans like that?
Yeah, we've got contingency plans within the facility where we can, again, go up 50% or 100% above our capacity if we have to. And then across the county, I know that they are looking at other locations. I understand that in New York, they're using convention centers or schools or concert venues where there's large open spaces that you can space people out. And it's possible we'll get to that point. We don't know. But I know contingency plans are being made for that.
I mentioned earlier that people, they're going to sources, sometimes the wrong sources, to get this information. But let's talk about a medical center like yourself. A lot of times with a medical crisis of some type, you'd turn to an old salt. You'd go to an old doc that's dealt with this before, that's been around forever. But in this circumstance, unless they were practicing during the Spanish flu epidemic, they're probably not going to have a lot of information for you. Are you reaching out to other medical centers around the country that are vested in this right now to get information and kind of get a lead on what's coming and how best to deal with it?
Yeah, I think we've got pretty good communication with colleagues. We have a fairly robust medical education set up in town between residency programs and the medical schools. And so there are graduates all around the country that we've got connections to that way, and people who have trained elsewhere have connections. I think the medical community has been fairly openly trying to share information together. It's not as linear as it would be in a time where you have the time to go through a proper channel with medical journals, but I think that people are sharing the information pretty closely. I think that the scope of the illness is more than what we're used to seeing as far as the total number of people, but the disease states that we're seeing are not, in individual cases, anything truly novel. When you get a high degree of inflammation in your body, it can impact all of your organ systems. People talk a lot about sepsis and how that impacts your body. You get an infection, your immune system responds and maybe over responds. You produce a whole lot of different chemicals called cytokines that are supposed to prompt your white blood cells to respond to an infection. And if they ramp up and up and up, it can be detrimental to your body. And most of the things that we see related to coronavirus where people become fatally ill are tied in with that inflammatory pathway. There's not a clean way to divert that pathway without having some unintended consequences, right? There's a whole web of chemicals involved. It is important that we support patients through that, which is where the number of ventilators available and the amount of medication available is really key, because a lot of it comes down to us supporting while the body heals itself, and it can take time, sometimes a couple of weeks.
Well, again, thanks for your time, Doc. I know that you're busy. I think I've pretty much run through my questions. Just in a nutshell, it sounds like you're as ready as you can be. You're as prepared as you can be with what you have to work with. I'm going to leave it with you here before we sign off. What's your last word of caution or advice for viewers of Podcast by George?
Yeah, as much as you can, stay home. A lot of it is very difficult. I know it's hard. The weather's nice. Everyone's aching to get back outside. But over the next couple of months, while this is running through, people staying away from each other and limiting the spread is what's going to help us survive this as a community. That's great. And that's from the front lines, folks. That's Dr. Jason Kruse at Broadlawns Medical Center reporting in for us today. Wish him all the best. Good luck to everybody. And like I tell everybody, quarantine safe and well. That's great advice, Doc. That's going to do it for today. We'll be back soon. We'll keep on top of this and report as often as we can with folks like Dr. Jason Kruse. But for right now, that's another podcast by George.